Testing has been a really important part of the state's fight against the virus, and for the past 2 years, Wild Health has handled a majority of Kentucky's COVID tests.
WKYT's Kristen Kennedy was granted exclusive access to Wild Health's lab and talked with the men and women working around the clock to get results out fast.
This single lab with its dozen workers sorting through hundreds of vials isn't running a variety of tests. They're just running one.
We're all COVID all the time here.
This is Wild Health's one and only testing laboratory. Their machines can handle more than 1,000 tests at a time. And lately, the number positive for SARS-CoV-2 or COVID has been the highest it's ever been.
We run 100 samples. To see 40 positives is a lot.
Wild Health's tests won't confirm specific variants, but they do know the latest Omicron has come with the biggest rise in rates.
Even Delta was only about 15 or 16%. This strain is particularly contagious, plus in the fact that we're during basically winter, so people are more indoors, air is drier, easier to infect the upper respiratory pathway.
Dr. A. Taylor Bright, Wild Health's lab director, predicted this surge. He's also predicting the next.
We had predicted Monday of Thanksgiving through about mid-January would be a surge. We didn't predict Omicron, but we had predicted we would have a surge. So we would expect this to tail out this week, or this month, mid-February, and then April have another uptick. And that's based on vaccination status.
He and his technicians know the more positives, the more patients in the hospital.
We see testing up. We know that hospitalizations will follow in 2 to 3 weeks. And so that can be disheartening, but I think the best part is that we are getting people the results that they need.
To get those results, he and his team work 7 days a week, sometimes 12-hour days. Each day starts with samples. Hundreds of vials are delivered around the clock. Each vial has a barcode, and each barcode contains its patient's contact information. Check-in takes a few clicks. Preparation for testing takes a few steps. And once the samples are in the machine, it takes a few hours for the computers to read and register results.
My job mainly is moving small quantities of liquid around, right? We're talking about 1 to 5% of a milliliter. So like minuscule amounts is all we really need because these machines are so sensitive. We can detect down to 10 copies of virus in your nose.
In surges, Dr. Bright can run these machines all night. They usually test up to 8,000 samples a day.
So these are all remote, so we can log in and we're all doing data up until 12, 12:30, 1 o'clock every night, getting data out so that people have the results. The schools can open in the morning. People know what they need to do to go to work.
Wild Health's small Lexington lab handles every sample they get. In Lexington, Kristen Kennedy, WKYT.
Wild Health leaders say in January of this year, they were testing in as many as 73 locations a day, averaging 5,000 tests per day. And as predicted, they are now seeing those positive case counts decline. I cannot even begin to think, Bill, how busy they have been over all of these months.
Wasn't that interesting to see how it all operates? And we'd heard the name since the beginning.